Hi, my name is Taylor Graves. I will be presenting an integrative review on two research studies. I have identified depression among young adults as a healthcare problem to review. Depression is considered one of the most common mental health disorders in the U.S. In 2016, over 16 million adults were affected by a major depressive episode in the U.S. alone. These occurrences were highest among individuals aged from 18 to 25 years old. The National Institute of Nursing Research, or the NINR, identified a priority that best fits the problem of depression related to wellness. It is stated that the best approach to overcoming an illness is to prevent it from ever occurring. This priority is aimed at promoting wellness and preventing disease development, such as depression. Healthy People 2020 has also identified a goal to improve mental health by preventing it altogether and ensuring proper access to mental health services. Proper mental health is necessary for good physical health and well-being. Two studies were reviewed. Sargent and Mongrain conducted a randomized controlled trial to determine the effect of a web-based intervention on decreasing the occurrence of depression in pessimistic individuals. The intervention group completed 5 to 10-minute online exercises every other day based on focusing on and recalling positive life experiences and viewing one's goals as achievable and worth working toward. The control group participated in online exercises and daily activities that were similar to the intervention group but did not include components of optimism. They focused more on self-awareness. The Center for Epidemiologic Studies of Depression, or the CESD scale, and the Dysfunctional Attitude Scale, or the DAS-14, measured the prevalence of depression. Optimism and pessimism were measured by the Revised Life Orientation Test, or the LOTR, and the Orientations to Happiness Scale, or the OTH scale. Sargent and Mongrain revealed that there was a significant reduction in depressive symptoms measured by the CESD in the intervention group. The DAS-14 revealed a decreased amount of dysfunctional attitudes throughout the course of the study. The OTH scale demonstrated an increase in life engagement after 3 weeks of intervention and a change in baseline to end results. The second study was performed by Linvet et al. It was also a randomized controlled trial, and the purpose of it was to determine if an unguided internet-based self-help intervention could lessen depression symptoms among a population of university students with psychological stress. The intervention group included access to 2 internet websites. One site provided awareness of individual depression symptoms and negative thoughts. The other site delivered info pertaining to depression symptoms, treatment options, and resources to obtain medical help. The control group was informed that they would receive instructions in several weeks, in which they were never contacted. After 8 weeks, both groups received a post-intervention questionnaire, re-examining their incidence of depressive and negative thoughts. Symptoms of depression were again measured using the CESD scale. Negative thoughts were measured using the Automatic Thoughts Questionnaire, or the ATQ, which is a 30-item questionnaire with 5 response categories. Study findings by Linvet et al. Revealed that depressive symptoms and negative thoughts were substantially lower in the intervention group than in the control group when the experiment was completed. Less suggestions of depression were supported in the intervention group, while fewer episodes of negative automatic thoughts were also evidenced. The control group did not reveal a significant change in negative thoughts, but did report more episodes of depression. To improve nursing practice, nurses and advanced practice nurses interact with young adults on a daily basis. With access to and knowledge of these particular studies, nurses can realize the importance of detecting symptoms of depression and negative thoughts in this population. They are able to recommend online sources and assistance to individuals of all ages that are affected by depression. These studies also provide the ability to recognize and prevent harmful effects of depression in young adults in other populations that they serve. If advanced practice nurses recognize depression early and help to prevent or treat it, better patient outcomes will result. Implementing the use of web-based interventions will help to improve and change nursing practice. A physician and/or practitioner's clinic in a rural health environment could utilize web-based interventions to aid in decreasing the incidence of depression in young adults. Any healthcare professional can refer patients to websites that may decrease their depression and/or negative thoughts. Providers in rural health clinics encounter many young adults and should implement this intervention to change and improve advanced nursing practice. This will help to lessen the harmful effects of depression and also improves patient outcomes. That is the end of my integrative review. Thank you for watching my presentation. Please email me with any questions you may have.